Well, medical professionals are sounding the alarm about this wave of new COVID-19 infections we've been witnessing now for the past week or so.
Their concern is that the number of cases increases then the burden on the healthcare system, and that could prove disastrous. Dr. Joshua Lenchus is the Chief Regional Medical Officer at Broward Health Medical Center. Dr. Lenchus, thank you so much for being with us. Now, at their surface, just when you look at those numbers, they seem pretty alarming. Do you agree that there's some pretty serious cause for concern right now?
Actually, no, I don't. I think that the number of cases, while it's increasing, is not proving to overwhelm the healthcare system, thankfully.
Well, that's the big question, Dr. Lenchus, in terms of the occupancy rate there in Broward Health. What's the situation there? Do you have enough beds? And how many cases are you seeing now, new cases that are COVID related?
Yeah, that's a great question. You know, we are seeing an increased number of cases in the community, but thankfully that has not translated into an increased number of patients coming into the hospital that are infected with COVID. And as far as capacity goes, we have plenty of space to take care of those patients that are infected still. We have not reached any level of surge yet at this point.
So it sounds like there is some good news. Beds are available. Patients will be able to get the care that they need, or at least be accommodated in the hospital. But what about staffing and the ability to care for patients who actually end up in those beds? Nurses, doctors, other support staff. What are those levels looking like right now at your hospital?
That's a great question. We thought about that when we crafted these plans. So presently we have enough staff to take care of everyone that's in the hospital and then some. We also have plans to surge up in the event that that's needed. We can increase our capacity by 20% in the first phase. That encompasses the healthcare resources and personnel that are needed to accomplish that.
So, Dr. Lenchus, we've been dealing with this now for, I guess, about 3 months or so. Do we have any better treatment protocols in place so that if someone does end up in ICU, there's a better chance for them to make it?
Well, we've been seeing the acuity of patients, how sick patients are, has definitely changed over the last 3 months. In the beginning part of this, we were seeing them very sick coming into the hospital. We're starting to see them not quite as sick, which is encouraging because it allows us to intervene much earlier. The landscape is constantly changing, so medications that were out and being touted for use early on, some of those medications we're still using, some of those medications that we're using today are brand new.
As far as the demographics of the patients being treated, initially we were hearing a lot about patients over 65. Again, those were most of the people being allowed to get tested in those early days. Now that testing is pretty much open to everyone, we're starting to see younger and younger patients, people between the ages of 18 and 34 testing positive. Are you seeing that age range in the hospital, or is it still the elderly patients who seem to be most susceptible to the impacts of this virus?
What we see today is very similar to what we have seen in the past, in that patients that are elderly or have other medical conditions certainly are more prone to having more serious disease. However, we have seen an increase in the number of patients that are coming to the hospital that are younger.
So, Dr. Lenchus, what would be your message to that younger demographic? Because Governor DeSantis earlier said that he points the finger squarely at them, people just not being socially distant, maybe not wearing masks as often. What would your message to those people be?
My message would be exactly as you alluded to. You know, we have known that wearing a mask, being distant physically from other people, staying out of the limelight if you're sick, washing your hands religiously, those are the same messages that we hope to impart on your audience tonight. That's really the same thing that has kept that curve flat during the initial part of this plateau that we're in, and we're certainly hopeful that that will continue to make its mark as we move forward.
Good advice, Dr. Lenchus. Thank you so much for joining us tonight from Broward Health Medical Center.